In the second part of today's lecture, we will go into community development approaches. To discuss community development approaches, we will take three case studies, three case examples, and try to see if we can describe the process that we talked about in the first part of this lecture. So to do that, we will look at community health planning and improvement efforts, collaborative partnerships of population health and health equality, and then community-based research participatory study. So the first case that we are going to look at will cover the approach of community health planning and improvement of core practices. So the example we are going to look at here is going to be an health departments, local health departments trying to meet certain accreditation standards. We discussed what accreditation standards were in class previously. That is to have like a baseline of all the standards, all the requirements that a health department need to have in order to ensure that they are providing quality care and that they can obtain funding at the state, federal, or national level. So this example will look at certain partnerships that were done at the local community health department to ensure that they can reach the accreditation standards. So the first step is going to be assure shared ownership of the process among stakeholders. That would be a discussion among all the local health departments in that area, saying yes, we are all stakeholders, we all need to meet these standards, so let's see if we can collaborate and work together. And then assure ongoing involvement of community members. So that will be all the local health community departments that will be involved. Then there is the concept of using small area analysis to identify communities with health disparities. For this, for this example, what they did was they used geomapping. We talked about this in class previously, a concept called GIS, Geographic Information Systems, where you can map on a certain map all the resources, all the needs, maybe certain types of diseases that are going on, certain epidemics, endemics. You can map it out. So what they did was they mapped out certain areas within their main area to identify if there are certain areas that have less resources and maybe some shortcomings. So that is where geomapping comes in. And then the next step was to collect and use the information on social determinants of health. So looking at the disparities in the area, they chose certain determinants such as income, education, and housing. So the areas that the local health departments serve, they looked at income levels, the education levels, the housing levels, and wanted to see if there are certain problems that needed to be addressed. The next step was to collect the information on the community assets. Now that they looked at all the health disparities that were there in certain regions where those health departments were serving, they also wanted to see what are the community assets and resources that are there. We have certain needs. Now, how can we bring in what we have in terms of resources to try to help meet these needs? And then the next step was to use explicit criteria and processes to set priorities. So yes, there are so many health needs or so many needs in the community, but it is important to prioritize them. And in this particular example, they had 5 priorities. Oh, the first one was access to health services, healthy food, mental health, physical activity, and poverty and jobs. So by prioritizing them, now they can say, yes, these are the resources we have. Maybe we can use these resources to try to hit these priority areas. And then the next step was to assure shared investment and commitment of diverse stakeholders. We talked about how initially they had to get together everybody who was interested in getting these accreditation, meeting these standards. They also wanted all the stakeholders, all the local health departments, all the sectors involved in this to be invested. So for this, they wanted everybody to have either a financial or human resource commitment from all their stakeholders. So either you contribute towards this effort in terms of money, or you have to contribute towards in terms of labor or members that will be involved in this process. Next is to ensure participatory monitoring and evaluation of their efforts, the community health efforts that were put in. To do so, they came up with an idea of training individuals in these efforts to be able to systematically document all the accomplishments. So whatever accomplishments that were be done during the strategic process needed to be documented properly. And then they also needed to make sure that they were communicating their findings, communicating the needs, and that there was ongoing discussion. That is why it's important to have collaboration across all the sectors and try to help implement the strategies that they came up with. And eventually, they also wanted to be able to establish oversight on all the mechanisms that were going on. They had a steering committee meet periodically to review the progress and implementation of the action plan. So not only they institute the action plans, they got everybody involved, they got a document as to what will be done, and also a committee to oversee everything that was going on. Eventually, they also created formal public reporting processes, and in this case, they opted out to use focus groups with the community partners to be able to see are they satisfied with the progress on the priority goals that were set, what are the other needs, what are some inputs they can do so that they can continually improve on this. So that was just one example of how you can get together with different community partners towards working towards a common goal. The next example we'll talk about, the next case, is a collaborative partnership of population health and health equalities. So for this study, this was a coalition of a multi-sectoral partnership made up of about 40 community partners. And all these community partners got together, they had established an organizational structure, they came up with a community advisory board to provide guidance, and then they came up to the point where they said, yes, we need an action plan. What are the high priority areas? What are the goals that we need for this partnership? And in this case, they came up with three different goals in the action committees. They were including healthy nutrition, physical activity, and access to health services. As you can see, even in our previous example, these were common themes. So looking at community health, these are certain topics that come up over and over again. Certain approaches might be different, but goals that community health work towards are eventually very similar. So to do so, once they got the three goals, they wanted to come up with an action plan to identify strategies to try to work towards them. So they established community gardens to try to improve nutrition. They created more space for physical activity, for soccer, and they also increased the availability of health services for which high quality translational services were available. Meaning again, whoever who needed access to healthcare, whether it's going to be needing transportation, whether it's needing a translator, whether it's needing a certain specialist for something, just to be able to bring access to individuals that need health services. And eventually for this particular partnership, they also provided mini grants. About 10,000 or less were distributed so that there is equal sharing of resources to try to help these action plans that they came up with in their strategic plans, and then most importantly document and get feedback so that they can continually improve. In this case, this particular example, they came up with graphs, they came up with certain tables, certain information that they could then share with the coalition and with anyone who could benefit from the efforts that they did. So the last example, the third case that we have is a community-based participatory research collaboration. For this was another community that wanted to see if they can use their community to partner up and do certain research studies in the community and share the information that they gathered. So the first thing they needed to do was recognize that they were one unit as the community. So when they do so, they can come up with certain common health disparities that are related to that community. In this case, they were related to chronic diseases such as diabetes and heart disease. So based on that, they were able to come up with the strengths and resources in their community, have certain collaborations in terms of research studies, in terms of certain studies that they were doing, and then gather that information. So in this case, whatever information they got from certain research studies, for example, if they implemented a certain food type, certain food program, or a certain physical activity program, when they did research with their scientific partners or the scientific community, they were able to get all these information together and then share it among the group. And in this way, they could have their community identified as one unit and work towards the benefit of everybody that's involved in that process. And the emphasis was to see that these health determinants that are happening, they are not just at one level, there are several levels, several determinants that are involved, and how each of them can contribute towards learning from each other. And once they have these findings, it is also important that they then distribute it among each other, share the knowledge that they have, so that there will be a long-term commitment, long-term process that each of them can benefit from each other. So the last topic we'll talk about for this lecture is about building healthy communities. When we talk about building healthy communities and community workforce, it's about people coming together, working together towards addressing certain health concerns. So this requires diverse diverse workforce skills in the community. Maybe it could be physicians with certain expertise, nurses, the public health officials, everybody coming together to try to build a community workforce. And to do so, there are three core competencies. Uh, One of the first ones is going to be monitoring health status through community assessment. So the assessment component looking at the health status. Next is to make sure that you have the community engaged in identifying health issues so that you can prioritize accordingly. The third core concept is mobilizing the community partnerships to be able to solve these identified problems. So once we have a community workforce in place, it is important to be able to use this to try to support the development, support the improvement of health aspects that are needed in the community. So that could be done by ongoing developmental processes of identified needs that were there in the community, look to see what capacities are involved, what needs to be developed, and what are the focuses, do they align with the goals that are needed for the community, and then what are the different aspects that needs to come together to accomplish these goals. So that is all we have for the lecture today. For today's lesson, we have one discussion question. I would like for students to visit the National Association of County and City Health Officials and look at their map process, and a link is provided. Using this map process, I want for students to look at the question of how you can help improve the mean daily intake of total vegetables in your community using all these 6 stages of the MAP model. If you have any questions, please let me know them through the Canvas system.